মনটা অনেকটা শান্ত হয়ে গেছে। জলের টার্বুলেন্সটা থেমে গেলে জলের তলার অংশটা দেখা যায়। মনটা শান্ত হয়ে গেলে মনের ভেতরে ইন্ট্রোস্পেক্ট করা যায়। সেই স্টেটটাতে রিচ করে যাচ্ছি মনে হচ্ছে শ্রদ্ধেয় গুরুদত্তদার আলোচনা শুনে। থ্যাংক ইউ গুরুদত্তদা। এরকম আচার্য বা মন্ত্র পুরুষের সান্নিধ্যে যিনি নিয়ত আছেন, যার জীবন চলন সেইভাবে নিয়ন্ত্রিত হয়ে তিনি ঠাকুরের ভাষায় একজন গুড এবং প্রমিসিং ডক্টর হয়ে উঠেছেন, মানুষকে হিল করছেন। আমরা মানুষকে ট্রিট করি, ঠাকুর বলেছেন হিল করতে হবে। সেরকম একজন ঠাকুরের সেবক তথা আমাদের শ্রদ্ধেয় আমি ডক্টর সুধারঞ্জন দেবনাথ দাকে একটু আমাদের কনক্লুডিং বক্তব্য তিনি রাখবেন। তিনি সুদূর দেওঘর থেকে আগত হয়েছেন। আমাদের আশ্রমের তিনি একজন নিয়ত চিকিৎসক এবং ঠাকুরের ডেডিকেটেড সার্ভেন্ট। তার মুখ থেকে আমরা আজকে কনক্লুডিং স্পিচ শুনে নেব। সুধারঞ্জন দেবনাথ।
Distinguished guests, my brothers and sisters, we have enriched ourselves a lot in the last almost 3 hours. I would take some amount of time to discuss some attributes of a good heart and ask ourselves a question. Do my heart feel the pain of others? Do my heart feel the pain of others? And at the same time, do my system give me that response from within to do something to make that pain and suffering of others heal? If the answer to this question is yes, well, we are very much armored, we are very much prepared to enter into the field of disease and death, and definitely we'll conquer that. If the answer is no, or we are confused, we need not answer others. Let us ask that question to ourselves, deep into our heart. If the answer is no or confused, it is time we set our inner compass right. In my school days, I read the story of Dr. Albert Schweitzer. Albert Schweitzer was a theologist born in Germany, and by the age of 30, he was a very established theologist, a very established musician, and he was leading a very peaceful life. Suddenly one day, while he was reading the newspaper in the morning, a news flashed into his mind regarding the sufferings of people in a remote place of Africa. They had no access to medical health care, no access to basic life amenities. Instantly, he felt it a clarion call from the deepest core of his heart to rise to this occasion and offer his service for that needy people over there. At the age of 30, when other medical graduates were busy practicing, he left his established profession and joined medical college. He studied intensely for 8 years And at the end of his intense training, he, along with his wife, left for that remotest part of the world unaided and started his service over there. There was language barrier, there was cultural barrier, there was lot of difficulties, but his conviction of working for people could not stop him. He continued his service. But again, when you serve, you should be ready also to face obstacles. During World War I, he was arrested, and along with his wife, he was imprisoned. He remained in prison, but even in prison, he was serving his fellow people, fellow prisoners. There also he was a healer. After World War I, he was released. He came back to Europe and he gave lectures, gave recitals, raised funds, traveled back again to that remotest part, and used that money collected to set up a big center over there and continued his service. He continued that, and when it was more than enough a human can do, he was called back to his place, requesting him to come back. He said, "No, these people need me here." And he stayed the whole of his life. He was awarded a Nobel Prize in Peace for his service to humanity. That is insignificant for him. He used the whole amount of his money for the service of mankind. He died at the age of 90 years. That was a big motivation for me at that time. In fact, I also thought that I should join medical science. That is a story. But that motivation does not stay for long. Because we are normal human beings, that innate compassion sometimes, vaporizes under environmental circumstances. But I should tell you, I am lucky enough to be by the side of someone, my living ideal, my living Lord, who is the source of this inspiration every day in my life. We have heard the story of Narendranath, Swami Vivekananda. We have heard that in his childhood, he used to sit by the side of his window and throw clothes and other belongings and other food items to anyone, people going nearby whom he felt that is a necessity for that person. My loved Lord, Sri Sri Thakur Anukul Chandra, when he was a child, 4 to 5 years old, he was traveling by a horse cart with his mother. The carter was whipping the horse. Seeing this child was very pained and was crying. The mother tried to make him understand this is necessary, otherwise the horse won't run. But he was inconsolable. They reached home. When the mother was changing the dress of the child, the mother was astonished to see there was whipping marks on the back of the child. This is heights of compassion. This is heights of feeling. They are love, Lord. When you follow them, when you observe them, when you love them, that love emanates into your being also. That is my feeling that I am saying. When we were in medical college, in my first year, we had a group discussion. Then a question came up, why did we join medical science? Most of the answers were all self-centered answers. Perhaps a few of us also had a intention of service to humanity, but perhaps under the pressure of the majority, they could not speak up. So, it is a fact that we enter medical science for gaining personal benefits, because there is respect, there is money, there is lot and lot of things. But if we do not set that question right from the beginning, who is going to suffer? Both myself and my patients. See, a lot of discussions have happened in the last few hours. We have seen that stress is the biggest culprit of non-communicable disease today. From where this stress is coming? It is from expectation. Can we not deliver our service without expectation? Is it not really possible humanly? It may be very difficult if we are alone. But under a able guidance, this is possible. I will give you a small instance with my life. There was a patient, a 30 years old female, along with her husband. They came to Devghar. The story is that female had a ptosis on one eye. They went to CMC Vellore. Their thorough investigation was done, and it was seen that she had a big aneurysm in the brain, which required intervention. The price of that was around 6.5 to 7 lakhs. They could not afford. They came back to Assam. They did the nivedan to my love lord. He asked me to talk to the patient and do the needful. I talked to the patient, I get to know the situation, and then I again conveyed this to him. He told me, do whatever is necessary to save this patient. So we have a friend at Coimbatore. He is a very good interventional radiologist. I contacted him. He told me, send the patient to me. I will do this, and a minimum cost of 5.5 lakhs will be required, because a flow diverter needs to be placed there, and flow diverter is around 4.5 lakhs. So we won't take anything, I won't charge anything, but the hospital needs something. So it will be done at 5.5 lakhs. Okay, fine. So Acharya Dev managed the whole amount of money for that patient. I myself did whatever is necessary to shift the patient there, because they did not have any money. They brought 1 lakh of money from Bangladesh, and that was already lost in CMC Vellore and all other investigations. So we arranged a person over there who would receive this person. We arranged some pocket money even for this person, food, stay, everything. He was in constant touch with us, the husband of the patient. Ultimately, the patient was operated and the patient was fine. That colleague of us who did the procedure, he posted that photo along with the patient. He posted that photo in our Satsang Medicos WhatsApp group. Seeing that photo, one of our colleague, doctor from Bangladesh, he commented that I know this patient and it is a very good thing that it has been done. Okay. The patient's husband was in constant touch. The patient was discharged from the hospital. Ultimately, the patient was made to board the train back to Howrah. From Howrah, they will leave to their hometown in Bangladesh. After the patient and his husband boarded the train, I could not contact them anymore. Their phone was not reachable. 1 day, 2 days, 3 days, I was really worried. Because, I don't know, because they had language problems, they had so much of things, they have got lost, I don't know. So, I tried to inquire in various ways, but there was no clue. Then I remembered this doctor from Bangladesh who commented in that post that he knows this person. I called him after 4 days. That this is the situation. Do you have any knowledge about the whereabouts of this patient? He told me yes. They returned home very well. I met him yesterday. She is doing fine. My heart was shattered. After doing so much for someone, Perhaps they thought if they contact me, we will be asking for the money. That is not the thing. But a minimum of human gratitude is expected. They did not show this. 15 days I was in trauma. Because I personally know how much I have taken the pain to go through all this. I am not speaking about my Acharya Dev, myself. So I was in trauma. After 15 days, I went and said everything to my Acharya Dev, that this is the situation. He had a glowing smile in his face and said, "How is the patient?" I told him, "She is fine." Then be happy. There was no reaction in his face. That is absolutely amazing. That is absolutely amazing. This is what percolates. This is what percolates. How much to do? Sometimes we feel, I have done enough. So this I have done enough, I have a story. I know I am taking your time already 3 hours, but still I just want to tell that story also. How much? We were in a tour and we went early morning to a place that is a border of West Bengal and Bangladesh. There, whenever Acharya Dev goes there, in any place, there is lot of people over there to come and see him, offer their offerings and love. So there, suddenly, in the crowd, a old lady was complaining of chest pain. So he asked me to go and see the patient. I went there. There's an old lady with a chest pain. Obviously, that is an emergency. I had a sorbitrate in my hand and I put the sorbitrate sublingually and asked the attendants to take her immediately to the nearest health center. I thought I have done enough. I came back, I conveyed the same to him and we left the place. In the evening, he asked me, "What is the condition of the patient?" I told, "I don't know. I have not taken the whereabouts of the patient." He told me, "If this could have been your mother, could you have not once taken the condition of this patient, how she is? Would you have not inquired?" I realized that day there is no definition of how much. The definition of how much is, if I can treat my patient like my near and dear ones, then the question is solved. Finally, again, how much? That is not doing for my patients, that is doing for myself. How much do we need? When we eat, we have a satiety center in the brain that tells us when to stop. There is also definitely higher center in our brain to dictate us when to stop. But we do not hear that conscience. My love Lord, who can, I should not say that way, but who can stay in any luxury situation he wants to, but he stays in a single room with 3 of his children and wife, and the simplicity of his life cannot be explained. That is a practical lesson for me. So how much is very important, otherwise lot of situations and diseases and things and everything that we have discussed is going to come to me. Is going to come to me. We as healers are not prone to disease and death. We should remind ourselves of this. Let us cultivate these instincts and traits in us and lead a blissful life ourselves and serve humanity with all compassion. Thank you so much.
জয় গুরু। সৎসঙ্গ মেডিকেল অ্যাসোসিয়েশনের পক্ষ থেকে আজ বাঁকুড়া সম্মিলনী মেডিকেল কলেজে যে সিএমই প্রোগ্রাম হলো, যারা যারা এসছেন তারা আমার পরম পিতার সন্তান আচার্য দেবের আশীর্বাদ নিয়ে এখানে উপস্থিত হয়েছে। অবিন দাদার আশীর্বাদে আমরা তার আশীর্বাদকে মাথায় নিয়ে যেন আর এগিয়ে চলতে পারি, এটাই কাম্য। আর আমাদের প্রফেশনটাকে তিনি যেমন চাইছেন, অবিন দাদার কথা আমার নিজের কানে শোনা, বড় ডাক্তার হওয়া নয়, ভালো ডাক্তার হতে হবে, এটাই আমাদের জন্য সবার উদ্দেশ্য হয়। আমি প্রদীপ্তকে বলবো শেষ করার জন্য।
আজকের প্যানাসিয়া প্রোগ্রামের বাঁকুড়ার মেডিকেল কলেজে যে অনুষ্ঠিত হলো তার মেন কান্ডারি ছিলেন স্যার, যার মাধ্যম দিয়ে ঠাকুর দয়া করে এই কাজটা করালেন। এত সুন্দর প্রোগ্রাম একটা গিফট হলো। সমস্ত ফ্যাকাল্টি, রেসপেক্টেড স্যার, টিচার্স, স্টুডেন্ট, প্রত্যেকে এদিকে ওদিকে সব দিকে যারা আছেন বিভিন্নভাবে, এমনকি আমাদের সমস্ত গ্রুপ ডি স্টাফ, হসপিটালের ইলেকট্রিশিয়ান, সমস্ত প্রত্যেককে যথাযোগ্য স্থানে আমার থ্যাঙ্কস, প্রণাম। এবং শ্রী ঠাকুরের কাছে এই প্রার্থনা করি প্রত্যেকে যেন আমরা ভালো মানুষ হই। ভালো মানুষ যদি না হই, ভালো ডাক্তার হই, ইঞ্জিনিয়ার হই, আইপিএস আইএস যাই হই, বিক্রি যদি হয়ে যায় সেই জায়গাতে গিয়েও আমরা দেশকে বিক্রি করে দেবো যদি আদর্শ জীবনে না থাকে। ফার্স্ট ভালো মানুষই হতে হবে। ক্যারেক্টার ইজ লস্ট, এভরিথিং ইজ লস্ট। সুতরাং সেই ক্যারেক্টার মেকিং এর ব্যাপারটাই আজকে আলোচনা হলো। এই সেমিনারটা যেন অন্য তথাকথিত সেমিনার থেকে একটু আলাদা হয়। সবার মনে এই দাগ নিয়ে আমরা যাব। প্যানাসিয়া আমাদের একটু অন্যরকম একটা সেমিনার উপহার দিল। ক্রেডিট পয়েন্টস কিছু নেই, ক্রেডিট পয়েন্টস ভেতরের আমার অন্তরে হবে আর কি। এরপরে রাতে যে ঘটনাগুলো ঘটবে এটাই আমার ক্রেডিট পয়েন্টস। আমার জীবনটা যদি চেঞ্জ হয় আজকে এই সমস্ত মানুষদের কথা শুনে, আমি পরের মুহূর্ত থেকে আমি চেঞ্জ করতে পারি, সেই ডিটারমিনেশন, সেই ভালোবাসা যদি হয় তাহলে আমি পারবো সেটা করতে। এবং সবাই আমরা আগামী দিনে যারা ডাক্তার হতে চলেছি এই আদর্শ নিয়েই আমরা হব, এটাই এখানে আজকে আমরা শপথ করলাম। তাই আবার আমি সবাইকে থ্যাঙ্কস জানাচ্ছি, আমাদের রেসপেক্টেড স্যার, যাদের অনুপ্রেরণা এবং অনুমতি ছাড়া এই প্রোগ্রাম আমরা এখানে করতেই পারতাম না। তারা এত ধৈর্য সহকারে শুনলেন, বিভিন্ন কাজ তাদের উপেক্ষা করে। তাদের প্রত্যেক জন্য আমি থ্যাঙ্কস জানাবো না, জানাবো ঠাকুরের কাছে প্রার্থনা তারা সুস্থ থাকুন, ভালো থাকুন এবং আরো ছাত্রকে তৈরি করতে হবে আমাদের এইভাবে। এটাই আমাদের আদর্শ হোক। সকলকে আমি প্রণাম, থ্যাঙ্কস, জয়গুরু জানাই। এখানেই প্রোগ্রাম শেষ হচ্ছে। আমাদের প্রত্যেকে আমরা লাঞ্চ নিয়ে আমরা বাড়ি যাবো। থ্যাংক ইউ।